Sydneysiders are this morning steeling themselves for an extended lockdown, with the New South Wales Premier warning there's likely to be more than 100 new cases today. Last night, health officials listed dozens more public exposure sites across the city, including two major shopping centres in inner Sydney. The New South Wales Premier has signalled Sydney's lockdown is unlikely now to be lifted as scheduled on Friday, predicting the city's big battle against the highly infectious Delta strain will get worse before it gets better.
The outbreak has already claimed one life, Sydney's first COVID death since late last year. At midnight, Victorian authorities slammed the border shut, declaring all of New South Wales and the ACT a red zone. Let's get more from our reporters Lara Hyam in Sydney's World Square and Erin Somerville at the Wodonga border. Good morning to both of you. Lara, the situation in Sydney is worsening. What's the expectation for today?
Good morning, Lisa. Well, it's extremely concerning. 77 cases of COVID were recorded yesterday, and we're expecting to get into the triple figures here, more than 100 figures expected today. That's courtesy of the Premier, who has made that prediction yesterday. Of that 77 cases, 55 have been linked to existing COVID cases. The rest remain under investigation. So quite a big workload ahead of contact tracers to try to isolate where exactly those strains of transmission are. Now, we do know of that breakdown. 32 of those individuals were in isolation at the time that they were infectious. 33 people were out in the community for the time that they were infectious. So some big concerning figures there in relation to that. That will be helping determine whether or not Sydney opens up at that time. In terms of our hospitalisations, we've had 52 people which are now in hospital, 15 individuals are in intensive care, and there are 5 people on ventilators. So it's not looking good. They're very concerning, especially since there has been our first COVID death recorded Saturday night. A woman passed away aged in her 90s at Liverpool Hospital. The message from the Premier is that if you don't abide by the public health orders, the consequences could be fatal.
More than 50 out of the 77 cases overnight were close family members of the person who had the virus. If you don't worry about yourself, that's your decision, but think about your closest family members, your closest people in your life. They're the people that are most impacted.
We've also had 48,000 tests recorded. The government wants that to be higher in a bid to try to isolate any rogue strains of COVID in the community.
So, Lara, I guess the question now is not whether the lockdown is going to go beyond Friday, which everyone's expecting it to, but how long for?
Well, it's been a big question. Many people asking the Premier, looking for certainty as to when that lockdown is going to lift. Of course, the response from the government has been that they'll be relying on the health advice and waiting some of those key data points. So that is the infectious period of when people have been in the community and how many cases of COVID will be under investigation. So obviously that comes out as part of the daily figures. Of course, we won't be having this lockdown lifted unless people in Sydney are going to comply with the public health orders. We've heard from police yesterday that there were over 100 infringement notices that were issued for people breaching the rules. They identified 3 significant events where police were called. One was a gathering of older men playing cards in Marrickville in the inner west of Sydney. Also, a group of young men aged in their 20s playing PlayStation when police arrived, and an 18th birthday party being celebrated in Auburn. So that was just 3 examples where compliance hadn't been happening. Police saying that they will be cracking down on anyone who breaches the rules.
And Erin, you're there on the Wodonga border. How are police enforcing these new rules that came in at midnight last night?
Well, traffic is starting to slow down here on the causeway at Wodonga as police are setting up a mobile checkpoint here. And that's what police will be working to do, is remaining mobile. Last year they set up hard borders at the Murray River crossing, they won't be doing that this time. Instead, they're finding more success in remaining mobile and responding to where the need is. So this morning we are seeing those checkpoints set up here where police will be diverting traffic, both New South Wales and Victorian traffic number plates, to make sure people are doing the right thing. Now, authorities have raised concerns about the number of people who have returned to Victoria over the last 24 hours and are worried that they might not be doing the right thing. Police are reminding people that if they've come from an orange zone, so that's New South Wales, before 11:59 p.m. last night, they need to go straight home, self-isolate and get a test, and they cannot leave their home until they have a negative test. If they've come from New South Wales after that time, 11:59 p.m, they need to go straight home and quarantine for 14 days and also have a COVID test. If they have COVID-19 symptoms or are identified as a close contact, they cannot come into Victoria.
What's the effect on a border town like Wodonga?
Albury-Wodonga is no stranger to border closures. The city has endured this 3 times in just over 1 year. The residents here really weren't surprised that this was coming. They've been talking about it all week. Effectively, New South Wales regional areas became orange zones at the school holidays, which meant a lot of people had to cancel their visits into northeast Victoria, which really relies on tourism, because people really didn't want to be quarantining for 14 days or having to wait for those test results over their holidays. So the border community has really already been affected before this red permit came in. But what's vital for border communities is that that border bubble permit remains, and it has this time, which means that New South Wales border zone residents and Victoria border zone residents can freely cross the Murray into these border communities with just proof of identity. But we have heard from residents and business owners that they are frustrated, that they always seem to sort of be at the coalface of these closures, regardless of how many cases are in the regions.
Difficult when you're on the border there. Erin and Lara in Sydney, thanks for the updates. Well, epidemiologist Mary-Louise McLaws joins us now from Sydney. As always, a very big thank you to you for your expertise. What are you going to be looking for when you look at the numbers today? We're already hearing that it will be more than 100.
Good morning, Lisa. What the experts should be looking at, and what they have been now starting to look at, is the proportion of cases that were out in the community that were not in isolation, be it partially or fully out in the community, because that will tell you how many people they may have been able to infect. And the other group that they'll be looking at is the geographic spread. So if they're having more hotspot areas, then they're aware that, of course, we're going to have more cases.
How are you feeling about the situation at the moment?
Oh, well, I mean, people use the term on a knife edge, but it's been on a knife edge since about the 19th of June. This is very precarious. This is a highly infectious agent. And the group that I'm very concerned about are those that don't have time to watch television in the morning or listen to the government updates, may not have the ability to get into their computer and go into the government sites to look at information. So they're just not hearing messaging, such as the elderly group, going to play cards, or the young ones playing PlayStation. They're not getting the message. I don't think it's because they're just difficult. I think they're just not getting the message. And particularly the groups that are working long hours, they're travelling long distances from the western suburbs and the southeastern suburbs, and they're just not having time to go get tested either. So the authorities might need to rethink about the opening times for testing clinics, having them open for longer times, and just getting messaging out there that people can see on buses and trains.
I guess when the retail shops are still open, there is that confusion over what should be happening. I've got to ask you whether you've changed your mind at all about how the lockdown's going and how long it should go for.
Well, keeping retail open, of course, is keeping, I imagine, the business sector inside, and they're hurting. But what the business sector need to understand is not to pressure the government, but to understand, and there's very good evidence from Professor Grafton in the ANU and from overseas that have been done for quite some many months now, where they looked at Australia, Japan, and many other countries that have gone for eradication, in other words, harder lockdowns right at the start, and found that it's better for the economy and, of course, for health. So what I would say is that if this had been done early on, fast, and possibly protracted for at least a week or two, we could have gotten out of this with an economy intact. So please close the retail. It sends a very distracting message to people who are just not hearing governments telling you why, and that it gives them options, and people can't take messaging as options. Don't go shopping, stay at home. Staying at home is better than, staying in a hospital. They need to hear very clear options about what this means.
And how long do you think the lockdown's going to last, looking at the current situation and the trends?
Look, the trend is going up for the proportion of people who are not in isolation at all, which then tells me there's a great deal of probability of more cases. And so that's going skyward at the moment. I suggest that we're in a lockdown for at least another 3 to 4 weeks. And then looking at whether or not you've got this under control, you need another couple of weeks to see that you've got zeros. And that tells you you've got mitigation. But a whole 28 days of zeros says that you've got eradication. Now, that 28 days doesn't mean you have to be in hard lockdown. It means you've then got to be in certain restrictions, but certainly a hard lockdown for at least another 3 or 4 weeks.
Just before you go, Mary-Louise, what do you think of the graphic ad that started playing in Sydney last night?
Oh, Lisa, look, HIV was my first pandemic, and it was heart-wrenching time. And one of the ads that one will never forget, of course, is the bowling ball and the Grim Reaper. But that didn't do much to bring people on side. The ad that really worked was if it's not on, it's not on, talking about people who have casual sex and saying to them very directly, please don't have sex unless the condom's on. And this ad is one of those ads where it's scary, but not everybody gets it. And so I would have thought that young people who are sadly have the greatest burden of infection and they drive this, really needs to go for the 20 to 39-year-olds. And it needs to be edgy and maybe even funny because they'll see this and go, that's not me. Now, yes, people struggle for oxygen, and it's slightly different than the wild strain, which is highly inflammatory, for all of your organs. But this one doesn't, I think ring bells for the young ones who need to be told, look, it's all about you at the moment. You're the ones that will get it, and you're the ones that will spread it.
Mary-Louise McLaws, thank you for your time this morning.
Stay safe.
Well, in other news, former Prime Minister Kevin Rudd personally lobbied the global head of Pfizer in a bid to bring forward the delivery of vaccine doses to Australia. It's been revealed Mr Rudd met virtually with Dr Albert Bourla on June the 30th. The meeting came days before the government announced Pfizer had agreed to change its delivery timetable. In a letter obtained by 7:30, Mr Rudd informed Scott Morrison of the conversation and said Dr Bourla had agreed to look at the schedule. Health Minister Greg Hunt says while the government was aware of Mr Rudd's actions, it's not aware if he had any impact on the outcome.
Life has returned to normal in Western Australia's Perth and Peel regions after the lifting of the last post-lockdown restrictions overnight. Masks are no longer required, limits on crowds and caps on hospital and aged care visits have been lifted. Major events can also return to the regions, and dancing is back on the cards.
Locals in Broken Hill say they fear the arrival of a large film crew from Sydney could bring COVID to the far west of New South Wales. More than 100 cast and crew will arrive in the remote city this week to shoot part of an upcoming series starring Isla Fisher and Josh Gad. There's also concern Broken Hill, which is closer to Adelaide than Sydney, could be booted out of a vital South Australian border bubble.